Welcome to the latest Global Skills Opportunity Awardee webinar from the McMaster Health Forum. I will provide you with a quick summary of the McMaster Health Forum, the Global Skills Opportunity Program, and how that program fits into the forum's work. Then I'll introduce you to our GSO awardee presenters today, Buvneet, Sanjeevani, and Tresha, who will talk about their virtual internship with the George Institute for Global Health in India. The McMaster Health Forum is a leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders to act as an agent of change by empowering stakeholders. The Global Skills Opportunity Student Mobility Projects aim to empower Canadian students, especially underrepresented students, to take advantage of international learning experiences and to develop skills such as problem solving, adaptability, resilience, and intercultural competency. While open to all undergraduate students, the national program targets groups for whom international experiences have traditionally been less accessible, specifically Indigenous students, students from low-income backgrounds, and those with disabilities. It also aims to diversify the destination countries where Canadian students pursue international learning. The McMaster Health Forum is proud to have been selected to host the Global Skills Opportunity Student Mobility Project from October 2021 to March 2025. This project will enable emerging leaders within McMaster University's undergraduate community to build knowledge and skills to support health and social system strengthening internationally. We will leverage McMaster Health Forum's programs to support skills development in policy, political and systems analysis, evidence synthesis, and stakeholder engagement, while building on our experience with student mentorship, leadership development, and facilitating international exchange. During the first half of the GSO program at McMaster Health Forum, we engaged 9 students who work with international partners in India, South Africa, and Trinidad and Tobago. During the latter half of our program, we engaged another 9 students working with international partners in Australia, Kosovo, India, and South Africa. There are 3 GSO awardee presenters today, one of whom is Buvneet, who at the time of the GSO experience was an undergraduate student pursuing an honors health science degree in the Biomedical Discovery and Commercialization program at McMaster University. Buvneet's research includes exploring paternal contributions to fetal development and investigating the role of microbiota in placental function during pregnancy. Through a virtual GSO internship, Buvneet hoped to aid in a career in public health with a focus on women's health justice and equity, particularly addressing healthcare disparities experienced by immigrant and racialized women. Another of today's GSO awardee presenters is Sanjeevani, who at the time of the GSO award was an undergraduate student specializing in sensory motor systems within the Life Sciences program at McMaster University. Sanjeevani has developed a keen interest in community engagement, public health, science dissemination, and mentorship. Through a virtual GSO internship, Sanjeevani hoped to gain valuable insights into the mechanisms and impacts of community action for health initiatives, contributing to a goal of advancing public health and community well-being on a global scale. Another of the GSO awardee presenters today is Tresha, who during GSO was an undergraduate student pursuing an honors Bachelor of Science in the Life Sciences program at McMaster University. Tresha's research interests focus on health equity, community engagement, and medical education. As a GSO awardee, Tresha aimed to apply the knowledge and skills gained through a virtual GSO internship into prospective work within the medical system in Canada. Buvneet, Sanjeevani, and Tresha, over to you.
Hello, and welcome to our webinar on our Global Skills Opportunity Experience, specifically our internship with India, facilitated by the McMaster Health Forum at the George Institute for Global Health. So my name is Buvneet. I'm a 4th-year Bachelor's Health Science BBC student, and my peers who also engaged in this opportunity are Tresha and Sanjeevani, and they're both level 4 Honors Bachelor of Science Life Sciences students. And today we're going to talk to you about our experiences with the Global Skills Opportunity.
So on the agenda for our presentation today, we're going to be talking about what is the George Institute, some of the goals of our presentation today, the 3 projects that our team worked on, as well as some of the main takeaway points that we took from our internship time. So what is the George Institute of Global Health? It is an independent medical research institute that is based in Australia, but has branches within China, India, and the United Kingdom. TGI India's mission is to improve the health of millions of people in India through the generation of research that is high quality for discovery and implementation. They have over 350 publications and a team of over 78 people. Our team did a virtual internship with TGI. However, to situate ourselves, as you can see on the map, TGI is located within New Delhi, India. TGI's mission can be condensed into three main objectives. First is better treatments, and that is finding the best treatment options or better treatment options for healthcare problems. Second is better care, and that includes transforming care, especially primary care, for their citizens. And then third is healthier societies, being able to harness the power of government, markets, and communities in order to improve population health. Majority of the projects that we worked on in our internship were part of the Healthier Societies program.
The George Institute has had a significant impact on health systems and policies in India. Its research has directly influenced national health policies, such as hypertension control programs and salt reduction strategies. Through its hypertension control initiatives, the Institute has improved access to essential health care by strengthening community based screening, treatment, and long term disease management. Additionally, programs like Smart Health, which leveraged digital tools for early disease detection, and road safety initiatives have strengthened healthcare delivery and emergency response across multiple states. These efforts contribute to building a more inclusive and effective health system. Before starting our internship with the George Institute for Global Health in India, our group set several key learning objectives that we aimed to achieve throughout our time with the organization. These objectives were designed to ensure that we made the most of the unique opportunity to work with such a renowned global health institution. Firstly, we aimed to develop a deeper understanding of global health research. As we were aware that global health challenges differ greatly between regions, we wanted to gain a broader perspective on the complexities these countries face. Our goal was to understand how research can contribute to addressing these challenges and to explore how health solutions are developed to be sustainable and context specific. Secondly, we wanted to improve our research methodology skills in global health settings. We recognized the importance of acquiring the skills needed for effective research, like conducting systematic literature reviews, synthesizing data, and developing robust research strategies. We hope to learn the tools and techniques that contribute to large scale health projects, with a focus on ensuring that research is both impactful and reliable in real world settings. Thirdly, we aim to learn about community centered health approaches in India. We were particularly interested in how community driven health initiatives could influence healthcare systems and improve health outcomes. Finally, we wanted to collaborate with cross disciplinary teams. We understood that global health problems are multifaceted and require the expertise of professionals from diverse fields. We hope to build experience in working alongside professionals from various disciplines, such as public health, healthcare policy, and technology, and as well learn how effective teamwork can drive meaningful health solutions. One of the key projects of the George Institute is Community Action for Health, which empowers communities to define their healthcare priorities and monitor reforms. Despite its potential, Community Action for Health is underutilized in India, partly due to a shift from active community driven advocacy to more passive approaches. The Patang project was developed to address this gap by synthesizing evidence, co-producing a learning platform, and assessing its impact on community engagement in health monitoring. The project follows a mixed methods, realist informed co-production approach and will be conducted over 5 years across 5 Indian states. Currently, the project is in its initial phase, focusing on a realist synthesis of community action health literature, including critical discourse analysis, to understand the context, mechanisms, and outcomes of community action for health interventions. This phase, which my work directly contributed to, will inform the development of scalable tools for strengthening community participation in health governance. My role in this project focused on the pilot literature review phase. I worked with the team to survey 4 major research databases, creating search strategies to identify relevant literature of community action for health interventions in India.
I conducted title and abstract screenings to filter key studies, helping lay the foundation for evidence synthesis. This research will directly support the development of the Patang Learning Platform, which will provide tools and resources for communities, civil society organizations, and policymakers to enhance community-led health initiatives.
The second project that we worked on was in collaboration with SPEAR, which stands for Social Participation for Health Engagement, Research, and Empowerment. SPEAR is an organization that collaborates with multiple stakeholders in service of health reform with a focus on empowerment of communities through the Sustainable Development Goal 3.8 of universal health coverage. A lot of social participation research aims at bridging the gaps between policymaking perspectives and the experiences and needs of those within the communities. Participation can vary depending on cultural and geographic context, to name two specific factors, but some examples of the participation that can be seen includes daily social activities to membership in formal organizations as some factors or examples. To give a little bit of history about social participation, in 1978, the Alma Ata Declaration set this bold vision for health for all. It recognized that communities play a vital role in shaping their own health systems. Decades later, there's still growing evidence confirming that social participation improves health outcomes, fosters inclusivity, and pushes governments to act. In 2000, John Swadhyaya Abhinayan carried forward the Health for All agenda in India to secure an adequate quality of health and healthcare for every Indian. By 2005, the National Rural Health Mission formalized the framework for community action. This ensured people's voices were heard in health decision-making. There is still work to be done to improve social participation of health, and this is where TGI comes into play. At the George Institute, social participation has been a long-term goal because when communities are empowered, health systems become stronger, more equitable, and truly for all individuals. So the SPEAR Realist Review examines how inclusiveness and social participation enhances health reforms, identifying contexts, mechanisms, and outcomes related to those resources. My role within this project was doing data extractions as well as indexing, and as well as some editing and revising of the manuscript. The methodology that was used in this realist review was analyzing studies from 2000s onward that included articles within English, French, and Spanish, and those that are articles of peer-reviewed and gray literature source. TGI India collaborated with partners in Argentina for this project as well. The expected outcome is to identify strategies to improve inclusive participation, evaluate its impact on health reform success, and also provide guidance to overcome barriers for marginalized communities.
So going into the internship, I expressed a lot of interest in women's health advocacy, and lucky for me, I got assigned a project called GRACE, which stands for Gender Responsive Advocacy and Research through CEDAW. And I'll go more into CEDAW later, but essentially it's a framework that works to eliminate discrimination against women. And what GRACE does is that it evaluates the effectiveness of the use of CEDAW in laws within India, Indonesia, South Africa, and Kenya. This is an initiative by the George itself, and it's aimed at addressing gender inequities in health within these regions. So why was GRACE created? Why was the project launched? Well, women who have survived violence experience a number of negative consequences on their sexual and reproductive health and overall health, including unsafe abortions, sexually transmitted infections, and mental health issues such as anxiety and depression. The rates of violence against women and gender-based discrimination continue to remain high, despite there being laws and legislations against discrimination. With the COVID-19 pandemic, the situation just became tenfold worse. And this is exactly why GRACE was launched, because we needed a way to evaluate the laws and see why they weren't actually preventing the discrimination. What was flawed in these laws? And so that's where CEDA comes in, because it's a fantastic framework for assessing and evaluating these laws in preventing discrimination and gender-based violence. So as I said before, CEDA is a framework developed by the UN in 1979 as an international bill under women's rights and stands for Convention on the Elimination of All Forms of Discrimination Against Women. And this was the primary framework that we used in the overarching projects of GRACE. And so what I worked on were two projects within GRACE called KESWA and POSH. KESWA stands for Kenya Sex Worker Alliance, and it's an umbrella organization supporting sex worker-led groups in Kenya by advocating for healthcare access and other human rights. And POSH is the Prevention, Prohibition, and Redressal of Sexual Harassment, specifically looking at sexual harassment of women in the workplace, which is an act in India in 2013. So here's just a visual depiction of the projects and the people that I worked on and worked with. So POSH and KESWA, like I said earlier, were the two projects that I worked on, and they were led by Gloria Benny and Anshul Modani, respectively. These are the people that I was in most communication with. They were the ones who were guiding me. They were my mentors, and they were the ones assigning me tasks and the first people that I would go to if I had any questions. Now, both these projects lie under the overarching project of GRACE. And this was led by Devaki Nambiar, which was Gloria Benny's and Anshul Modani's supervisor, so the higher supervisor for me. And I would have bi-weekly meetings with Devaki, and we would catch up on my progress and how I was finding my internship. She was a really, really inspiring woman and honestly very empowering, and I hope to do work just like her in the future. And all of these projects, mine, which was GRACE, Sphere, and Padang, so Tresha and Sanjeevani's projects, all come under the greater umbrella project of Healthier Societies, which Devaki Nambiar is the program director of Healthier Societies. However, it's led by Kent Bruce. So what exactly was I doing during my internship? Well, the methodology for GRACE includes writing up desk reviews to challenge the context around those legislations. And so for KESWA, I was actually working on the very end of the project, which was actually creating the desk review, specifically writing up the discussion portion of the desk review. And honestly, this was my favorite part of the internship because I got to look into all of the extractions of the legislations, the laws, and the policies within Kenya that are meant to help Kenyan sex workers, but there are so many discrepancies between the laws and the actual lived realities between for the Kenyan sex workers. So what I did in this discussion was essentially illuminate those discrepancies and say, hey, here is all the laws that are supposed to be helping these people, but this is what the people are experiencing. So what are the laws not doing? What are they lacking? This type of writing style is something I had never engaged in before. And once I started, I knew that this is something I wanted to do in my future because I felt so passionate about it. And the second project that we worked on was for POSH, which I was involved in the very early stages of this project, which was actually extracting the laws itself. So POSH, in this project, we were looking at informal sex workers and legislations that exist in 40 different countries within those 4 regions that I had mentioned. So this was very looking at it in a very broad manner and seeing, hey, is there even a legislation that addresses informal workers and their rights? And we were developing a framework for these, for the extraction piece itself. This was all meant to go into a desk review, but of course I was only involved in the beginning pieces. So it was really nice to work on both of these projects because I got exposure to both ends of the process of writing a desk review. So I wanted to talk a little bit about my experience in the internship and through the GSO program. Unfortunately, we weren't able to go in person to India. And so while this did take away from the cultural experience we could have had, I can't say it took anything away from the meaning of the projects itself. being able to work on projects that had real world applications, knowing that all the work that we were doing was actually going to be helping these people was so incredibly meaningful to me. I also got to have some really heart-to-heart conversations with my mentors, just about career paths and why they chose the public health route. And being of Indian heritage myself, this entire internship was just a very powerful experience for me and eye-opening. It showed me what I really wanted to do with my career. And so despite it being online, and that's why I have the little photo of our meetings, which would be sometimes at odd hours, it was worth it for me because this was a once-in-a-lifetime experience, even if it was just through my laptop. So when the three of us talked about what we took away from this experience, our top three key takeaways were being able to develop a deeper understanding of social participation in health systems and its role in policymaking and equity. We were able to strengthen our skills in literature review, systematic analysis, and evidence synthesis for global health research. And being able to work with experts from global institutions really allowed us to improve our cross-cultural communication and teamwork. So to anyone who is interested in taking on a GSO internship, whether virtual or abroad, we say do it. Lastly, we would like to thank James, Dr. Devaki Nambiar, the team members at Badang, Sphere, and Grace, our mentors, Alexandra and Vidhi, and the McMaster Health Forum and Forab Lab staff. This experience wouldn't have been as rich and fruitful if it wasn't for all of these people working in the background helping us. So thank you so much.
Thank you to our GSO presenters today, and thank you to you for tuning in and supporting the McMaster Health Forum and our programs. If you're interested in learning more about our GSO program, the first link on the screen will take you to that program's website, and the other two links will take you to presentations and webinars conducted by both our GSO awardees and our previous Queen Elizabeth Scholars.